Hey guys, I'm Colton,
I'm Allison.
and we're here today. We're gonna do a short little tutorial on how to check blood pressure.
All right, so first we're going to go over what instruments we're going to need to check the blood pressure. Here we have 3 sizes of the cuffs that you'll use to check pressure. This one is for the child, this is for a regular size adult, and we also have a large one that could be for anybody that is obese or is a bodybuilder. We want to make sure they at least cover 80% of the arm, so it is crucial to have the right cuff size for the patient. Here we have the sphygmomanometer. This is what it is used for the numbers to actually read your blood pressure. Here are the pumps. This is actually to pump that air into the cuff. We have an open and closed valve on there as well. You want to make sure it's all the way to the right, which means it's closed to pump up that air into the cuff. And then as you see in a little bit, you'll see once you release it, you're going to turn it to the left, and that will bring down the air of the cuff. You're also going to need a stethoscope, and Colton will go through that as well once he gets that on. And then if you're doing practice and you're practicing with different people, you want to make sure you have these alcohol swabs as well to make sure it stays clean.
So, pretty much to start off with, you want to make sure you have your stethoscope. There are different kinds. This one has a double head for the big side, and the little side you can flip them. For today's blood pressure check, make sure you're going to be using the big side, and also make sure with your earpieces that they're going to be angled in like that. You want them angled in towards the front of your body. And then also we have our sphygmomanometer. I know that sounds like a big word. Took me a couple minutes to learn how to pronounce it. You can also call it a blood pressure cuff, however you want to. And if you ever see like paperwork or something that you get from your doctor, if it says 136/84 BP, that's going to be your blood pressure. The top number is going to be your systolic. Bottom number is going to be your diastolic. Systolic is going to be what the pressure coming out of the heart. Diastolic is going to be what's going back into the heart. All right. And I'm going to get Allison ready to check her blood pressure, so she's going to take over from here.
All right, so the first thing you want to do is palpate. It'll be the brachial artery, which is going to be found on the inner part of the arm, and that's where you're going to put the stethoscope.
All right, so make sure when you put the cuff on, guys, that the artery arrow, most cuffs are going to have them, that the arrow is aligned with the brachial artery right there.
The stethoscope. So as he puts the cuff on my left arm is what we usually recommend because it is closer to the heart, and he wants to make sure the cuff covers at least 80% of that arm. And you can have a little holder for the sphygmomanometer. That way he can see it as he checks it. And then on the cuff as well, where you're going to be pumping the air into the cuff, there is an open and close dial. And you want to make sure that is all the way closed for when you check it, or you'll just keep pressing the button and nothing will happen.
All right, here we go.
It is important to remember to make sure the patient's arm is resting and relaxed as shown.
And as you press, you want to make sure the cuff does get tighter, and that puts the air into the sphygmometer. You at least want to make sure it goes to 180 to 200. There's no need to go over that. And then what you're going to be listening for is the carotid cough sounds. There will at least be 5 of them. The first one will be the systolic pressure, and the last one you hear will be the diastolic pressure. And as you see it go down, you'll notice that the needle goes about 1 to 3 each second. You don't want to go too fast because you want to make sure you hear those sounds. And you'll notice it palpate a little bit. And then once you hear that last song, you'll release the air. Okay, and then once he's done, you want to make sure to loosen the dial. That way all the air comes out and it does not stay tight on the patient's arm.
Must be a little nervous. I got about 140/80.
And it's as simple as that.